Hello, everyone, and welcome. I'm Ricardo Pires. I'll be hosting this second episode of TEF-Health podcast series. I'm very happy to have you here. And first things first, let me recall what TEF-Health is all about. TEF-Health is the testing and experimentation facility for health AI and robotics that is really transforming healthcare by accelerating medical innovation from lab to market. This is an European cutting-edge network for real-world testing and validation of AI and robotics solutions in the field of healthcare. If you want to know much more about our service offerings, our activities, and all the exciting opportunities that TEF-Health can bring you, I invite you to visit our website, TEF-Health.eu. That's TEF-Health.eu. And in today's episode, I'm very happy to be joined here by Martin Rappe. He's an attorney and a legal researcher from the research team of CRIDS, that is the Research Center in Information Law and Society from the University of Namur in Belgium, which is actually one of the partners of the TEF-Health consortium. With Martin today, we'll dive into the AI Act and tap into his expertise to understand what SMEs need to know and where they should actually start when it comes with this regulation. So, Martin, thank you very much for joining us today.
Thank you for the invitation. Always pleased to speak about this wonderful project.
Great. Yeah, let's try to jump a little bit into the AI Act. I know you have a lot of things to teach us and to go through with us. But yeah, so I mean, can we start by, for us, can you give us, our listeners and our viewers, kind of a quick overview of the AI Act and, what is the aim and the scope of the AI Act, and especially, in the context of healthcare, what should we have in mind?
Yeah, sure. So the AI Act is a European regulation which has been voted in July 2024, which is already entered into force, but not entered into application. So it means that it's not applicable yet for its whole. Only a few provisions are already applicable today. And so basically it tried to strike a balance between innovation and the protection of health, security, and fundamental rights of the people, of the European people. And so it will gradually enter into application starting from 2025 to 2027.
Okay, fantastic. And in terms of all this balance that you're already touching, in terms of the balance between innovation and the protection of of freedom and fundamental rights and so on, can you elaborate a little bit more on this aspect?
Yeah. So it's all the problem that we face in Europe. We are always trying to find kind of a balance between the need to innovate, to be still on the page when you compare it to China or to the United States. And then we have the need also to protect fundamental rights, which is at the core of our democratic society in the European Union. And so the AI Act is based on that, because part of the regulation is about how to protect freedom and fundamental rights, and part of the regulation, with all what is related to the regulatory sandboxes and so on, is more about how to help innovation within the European Union, which is especially one of the purpose of the TEF-Health project. So it's good to talk about it.
Mm-hmm. Yeah, and so you're talking here kind of a regulation that is, this risk-based approach. So the way it was actually implemented is it sits on this risk-based approach. Can you, explain us a little bit more? What does it mean, and what we should be taking in consideration in this case?
Yeah, so in fact, the AI Act is a product safety regulation, such, for instance, as the medical devices regulation and many other regulations that we have in the European Union, which are part of what we call the new legislative framework. And so all these regulations are basically based on applying a risk-based approach. So it means that the level of requirements that are applying depends on the level of risk of what you are developing. So if the AI system is really risky, it's forbidden. if it's high risk, but a risk that still is acceptable for the European society, it will be deemed as high risk, and you will have a high level of requirements that will be applicable to the system and also to the deployers of such system. And then you will have systems that are considered needed that are needing to some transparency requirements, let's say. And so you will have to apply some information requirements and so on. And then all the other systems are not truly regulated, except for a few provisions, but that's something else. And then you have something a bit apart of this first risk-based approach, which is applying to the general purpose AI model, which are beyond some AI systems that we all know, such as ChatGPT, Copilot, and so on. But they are a bit apart of this risk-based approach.
Okay, that you touched one thing that is confusing for some of us and some companies that are you have the this is a system and this is a model. Can you just deconvolute a little bit this information about what you're talking about when you pick up when you mention that you have a model or you have a system and where does it fit, and I get the technicality and then I got lost in the legal part. So can you explain that and give us some more context on this?
Yeah, I can understand that you're lost. It's also the time. It's also the case of.
I'm not the only one for sure.
No, you're not the only one. I can confirm that. So yes, beyond of the system, you have the model. So the model, which is developed in order to put on the market an AI system at the end of the day. The system is truly the final application layer, if you want. So it's really the tool that you're using, for instance, ChatGPT, Copilot. But beyond that, you have a general model, for instance, and for instance, let's take the example of GPT-4, which is the model used to train, that is trained to afterwards develop ChatGPT. And so normally, all of the requirements of the AI Act are applying directly to the system. So the final layer, the product, which is put on the market. But there is one exception, which is related to the general purpose AI models. So the models that can serve, that can be embedded into a lot of different systems, because they are capable of, the text says, of doing a lot of tasks, a lot of different tasks in a lot of different sectors and so on. And so basically that's the case of ChatGPT and so on. So ChatGPT is not considered a general purpose AI model. It's GPT-4, which is considered as a general purpose AI model. And so it's GPT-4, which is regulated, not directly ChatGPT in this case, but of course, indirectly it is, because the model on behind of it, it's regulated.
Okay. So here I think maybe another, not a misconception, but something that needs to be explained is also, and the AI Act separates it very, very well from what I understood, is that you actually have someone that actually is the developer and actually some other one that can be the developer and supplier, or only supplier. Can you align exactly with what you were just saying about the model and the system to distinguish who is the developer and who is the supplier? What's this all about?
Yeah, so the AI Act speaks about deployers. The deployer is truly the one who developed the system and put it on the market under its trademark, for instance. So OpenAI is the deployer of ChatGPT, if I take back this example. But sometimes you can have different deployers. You can have the deployer, or the developer, let's say, maybe, of the model, and then the model is embedded into a system which is not the system, which is not ChatGPT, for instance. If you embed GPT-4 into a whole new system that you are developing, you will be considered as the deployer of your system. And of course, OpenAI will remain the developer of the model, of the GPT-4 model, which is on behind that.
Okay, that's good. Okay, that's very clear. So in terms of, let's probably follow on that. That is, on these high risk AI deployers. I mean, on the obligations of this kind of teams, right? So what would be these high level obligations of deployers of high risk AI systems, and in particular, which specific measures do they need to take, or which concerns do they need to be keep in mind so that they can, navigate through what they need to do, right, to deploy?
Yeah, there are a lot of these requirements, but I can provide you some examples. But first thing first, I think that something which is very important to understand is the fact that the requirements applicable to high-risk AI systems under the AI Act are already very technical for a lawyer, such I am, but they are still a bit abstract, maybe for people from the really technique, and so one thing is that there are also harmonized standards that will be developed, and they will enhance better compliancy with these provisions, with the requirements applicable to high-risk AI systems. So, for instance, you will have kind of presumption if you are respecting harmonized standards, and these are under development currently across the Sensenelec groups in the European Union, and these will be, for instance, ISO standard. And if you respect these ISO standard that which are more technical, normally you will respect all these requirements applicable to high-risk AI systems. But if you come directly to the requirements, you have, for instance, some requirements in terms of data quality, to use high-quality representative and error-free data sets. So it means that even before putting your system on the market, you have to think about the future application of the AI Act. You have also some provisions that are applicable in terms of transparency. So you have, for instance, to maintain up-to-date technical documentation and to provide clear user manuals. That's another example. And you have the very important requirement for me, which is applicable to the human oversight. So we are not yet into kind of Terminator word, because all the high-risk AI systems will have to work with human and for human, not in place of human. They will be to be overseen, and measures will have to be implemented to keep humans in control of AI systems.
Okay. Makes total sense. Okay. So I mean, in terms, if I'm developing such a system, I need to be, considering all these kind of things in one go. One thing that you mentioned is that somehow I got the feeling that I have to anticipate a few of the things that are still being implemented as the AI Act gets, itself deployed as we go. And then what we also see is that we have a context of different regulations or regulatory scenarios in place that kind of crosstalk. And if I'm a company, I need to be taken care of, or keeping in mind the AI Act. But then there is a GDPR layer, there is a MDR layer in terms of the medical device regulation. So, and there's much more, right? So I don't just want to overcomplicate the scenario, but I wanted to have a little bit here your opinion on the fact that, so I'm a company, I don't know much about legals. Of course, I need to comply, but I need first to know my journey. But then what should I do? Which regulation should I look first? Can I look first at one, or I need to be taking all in consideration? I think this is a challenging question, right?
Yeah, that's a challenging question, because in fact, there are a lot of regulations that might be applicable, depending also on the specific use case, of course. I think that the GDPR, when you are developing an AI system that will be applicable at the healthcare sector, it's a mistake. You have to take into account the GDPR first, probably, because it will apply to all the databases that you will use to for instance, to train your systems and so on. So even before the MDR and the AI Act apply, because they will apply more when the product is into the latest phases, at least, of testing. So testing in real-world environment, for instance, for what is related to the AI Act. But I think that it may appear not logical for technical people, but I think that the first thing you have to do is to contact support from legal experts at the very beginning of the process. As I said, I don't think that during the implementation phases, you will still have a need to have lawyers with you. because these are more technical and regulated by technical standards. But at least when you start, when you have just an idea or a POC, for instance, and you start to develop something, you need maybe to ask for support from legal experts, because you have to take all of that into considerations by design from the beginning, at least for what it's related to the GDPR. Because you have to maybe adapt the architecture of your database and some stuff like this from the beginning, in fact.
Yeah, that's a kind of a very practical advice, and I probably I'd like to hear you more on that line in terms of which kind of for practicalities can we kind of list here so that companies will have some sort of a more enlightened journey ahead. And you just you just kind of explained that we have multiple regulations that need to be kept in mind because of their different scope. But what and how can SMEs, companies that are really developing this AI and really the robotics components for healthcare, what should they do today to be prepared for this regulation? I mean, can you list a little bit more practical advices for them to go through this, and to navigate really through, because it's pretty much challenging, but there is really a purpose for many of these kind of parts on the regulation, namely.
Yes, it's not easy. Yeah, of course, it's a bit complicated for everyone to know it currently. But yeah, as I said, you have to take the regulatory part from the beginning, from the scratch. When you have an idea, you start to develop your system, and then you will see which are the regulations that will apply. You start to think about how you will comply in the future with all the requirements, or you will be able to follow maybe an agile process if you are developing a dynamic AI, for instance. We with TEF, we working on that. We will provide some guidelines to the SMEs. We try to develop such dynamic AI, because the point is that they will continue to learn after being placed on the market. So will they have to go through another certification process and so on? So it means that it's a bit a continuous learning also for the SMEs. But from scratch, you have to start to think about the legal points, and then you can maybe dive into the more technical part of the process, taking into account the legal perspective, and you can work on the testing and so on, and to the pre-certification and then the certification process, and then you can put your system on the market, and you still have to respect the requirements that you have been taken into account previously. So I really think that that's a bit hit. You first, maybe it's not logical, but you first have to think about the legal perspective, and then you implement the technical part that will be compliant by design, let's say.
Yeah, that's a very good point. I mean, we
Sorry, I
get
don't
a
know
lot
if
of
it answers very well your question, but
no, it's absolutely very relevant what you said. It's just that the connecting the dots for the SMEs is not really always straightforward. So what we get as we go, and you mentioned already kind of some of the aspects that TEF-Health is really supporting. There's a standardization and the agile procedure that you were just mentioning that is also being developed as we go in TEF, that will be bringing it will be a game changer on the long run as an outcome that will come out for sure from TEF, and it will be supporting the companies to actually know what to do in terms of procedure and journey. But I wanted to go a little bit back, because you mentioned a few of the things, and you were talking about a dynamic AI and so on, and when we support through the TEF, we support a lot of these companies that get and apply to our open calls for getting our services on this AI and robotics context. We get very blunt questions, right? So I mean, I remember some of the companies asking, and they still ask, so do I need a notified body? And the question was that, right? So, and then you got lost in terms of what should you reply to them. So I mean, if I ask you, does my company need a notified body? Is this a straightforward answer or not?
Unfortunately not. As usual, there are
I bet it's
there,
not.
there are always exceptions. It's a bit a case by case assessment to be carried out. So you have to think first about the maybe the articulation that you may have between the AI Act and the MDR, because sometimes you will have to go through a notified body under the MDR, and then in this case, it's the notified body which is competent under the MDR, which will assess whether you have respected all the requirements of the MDR and also the requirements applicable to the I system, the high risk I systems in this case, under the I Act. In other cases, but I truly think that they will be, under the I Act. Per se, you have a lot of possibilities to only certify something internally, so not going to go to a notified body. But under the MDR, I'm not sure that this is that's straightforward. And so in this case, the articulation between both regulation will be a key, I think. So it's why I cannot, unfortunately, answer you maybe clearer than that. But there are situations in which you will not have to go before a notified body, but again, it's something that you have to assess very cautiously at the beginning of the process to know what you will have to do in the future and to plan that and to not be surprised just at the end of the process. So that's why I really think that the key is to assess it by design, to take into account the legal perspective by design.
Okay. That's another thing that we also insist, and we hear in many of presentations like this one that we are doing here, and even in your video series that I'll be promoting by the end of the podcast. I'll be promoting your CRIDS video series on the AI Act, which is very very good and very complementing a little bit of what we are doing here. But it's exactly that sense of starting with legals from the beginning that is kind of a push that the whole context and all the advisors and the consultancy world is putting onto the SMEs, but still, I think they need to know where to start so that they can actually start with a legal perspective and legal overview. And because all the legal kind of scenarios are also maturing and being implemented, and parts of the Act, for instance, are just deploying as they go. I think it's challenging for those that are developing and don't know what to do.
Under the Act, the key from the beginning is to assess what's the level of risk of the system because of this risk-based approach. So the first thing to do is really that, and so it's also a need to take the legal perspective into account. Sorry, but that's okay. It confirms what I said.
No, absolutely. You're right. It's a great point. So I want to go a little bit back. You were explaining this part before, and I was thinking about so if the AI Act, and I think at some point we covered a little bit these things on other events on TEF, and I'm just recalling to ask you that is AI Act covering everything that is developed internally, and how is it connected to the a broad context? Out of Europe, is this AI Act touching any other parts, or is this only and solely implementations on Europe, or what does the AI Act brings in terms of things that are developed abroad or things that are partially developed abroad? I don't know. Just give us a little bit some insight here.
And the territorial scope of the Act is very broad, such as the one of the GDPR, for instance. It's the Commission and the European institutions wanted to apply to create such a Brussels effect, such as the one we know with the GDPR. So trying to push the other countries to have regulations similar to the AI Act, and foreigners companies to apply potential requirements of the AI Act. And so it applies as soon as the results of an AI system issues within the European Union territory. And so basically it means everything. So at least as someone in Europe use the system and use one result of the system in Europe, it's considered the AI Act apply. I mean, so it's very, very broad. It can have implications all around the world, let's say, I think.
Yeah, I was just wondering here. We see, you know, all the implementations and the activities that things like the TEF-Health are actually doing to support the companies to actually bring their AI and robotic systems and innovations to the market, right? But there's this layer of legal work, and because exactly you are doing a lot of kind of research on digital legal, I would say, or the connecting for sure with digital health. How do you see the scenario on the long run? Because you have all this, you know, very strong and needed regulation to deploy trustworthy solutions, but then you need a very good and robust also turnover of support in terms of legal for companies to go through all these procedures. And there's always kind of cycles of consultancy being more important, and I think might be also a hype now on the need for legal people to be working very much together with the companies, especially on the healthcare and digital healthcare solutions. I mean, how do you see this push on the long run, and do we have enough enough infrastructures to cope with what AI Act is going to push us through?
It's the main question. I mean, practically speaking, it will be the main question. Theoretically, it was the purpose. So we know that we will have a legal burden, an administrative burden that will be way higher than in the US, for instance. But on the other hand, there are mechanisms in the AI Act that try to make it less important for the SME, and so you have all what is related to the regulatory sandboxes and so on. But in practice, we will see whether our resources or infrastructures are sufficient. I'm not really sure that it will be the case, but it's purely my opinion. We will see. Regulatory sandboxes are not something new. These are already existing under others regulation. I don't really know, to be fully honest with you, what's the outcome from this sandboxes under the others regulation. But yeah, we'll see in practice, because there are so much regulation that I'm not sure that the public health will be sufficient at some point to support all of the SMEs. We'll see.
No, that's a very good point. And actually, one use case that is, or one aspect that is important is the sandboxes. And you were mentioning about, they have been used in other sectors or in other applications and so on. I remember sandboxes on when there was a massive hype, or it was more broadly spread, the blockchain technology and so on. And there was a kind of some sandboxes for blockchain, but the outcomes were probably not as impactful, I would say, as AI systems in healthcare can actually bring. So I think it's even more important, like you mentioned. I think it's a very good point that sandboxes are another kind of instrument or another asset from the European kind of infrastructure to actually support the companies to deploy and to test things
alongside with the Fed, of course.
Absolutely, yes. So I think that's a very good point that you put it there. So Martin, any other final thoughts or final recommendations? I think you brought already a lot in a very compact format, in a nutshell, like we used to say. But I think you brought already a lot of important information here condensed in these few minutes. But any other thing that you remember that would be interesting for SMEs, namely for those that are really developing and pushing these things to happen?
Yeah, there is one point maybe that I did not mention yet. That's the one related to the responsibility alongside the AI value chain. This Article 25 of the AI Act, but let's forget that. It's the fact that if you take one model, for instance, or one system that is not high risk, and because of the use you make of the system, it becomes an high risk system. You will be responsible. You will be the high risk system provider, and the previous provider will not be considered as the provider. And so there are contracts that will have to be concluded to deal with it. So that's also something to take into account if you are not developing from A to Z all the systems yourself. So for instance, if you are reusing a LLM or something like that on which you are constructing your new system that you will put on the market afterwards, you have to take it into consideration also. So maybe something to take account additionally to what I already said.
In consideration, yeah. No, this is also another very good point. I think, Marta, I think we are running out of our time. I'll have to make it a closure today and here. And thank you very much for your very clear and comprehensive explanation here on all these aspects of the AI Act. I mean, we need really to keep all these things in mind, and as soon as possible, as much as possible, follow up on all these aspects. So, okay, today we provided an overview of the AI Act, focusing on its obligations and implications for SMEs developing AI-based innovations in healthcare. We also covered a little bit practical steps on SMEs can actually take to navigate the path towards building trustworthy AI, like we mentioned. And as we wrap up now, we encourage our listeners to continue exploring the vast opportunities that AI offers, while of course ensuring compliance with the regulations. So I mentioned before, the CRIDS research team at the University of Namur, which Martin is part of, has created a highly detailed video series, which are very nice, entitled the 11 Shades of AI Act. I don't know, Martin, if you want to mention a little bit here some of the things.
Yeah, but basically we dive into all the aspects of the AI Act in I think compact way, but still comprehensive, I hope. But really I can recommend also, of course, to go and to see them.
No, absolutely. It's very, very detailed and very to the point in certain things, very short, kind of 10-minute video, something like that. Yeah. So I really encourage our listeners and our viewers to actually go back there and check. So we'll leave kind of a link on the comment section here. So that's it. Until the next episode, stay informed, stay innovative, stay compliant, and learn how TEF-Health can help fast track your AI and robotic innovations in the healthcare market. Don't forget to give your thumbs up as usual to this episode and to subscribe to the TEF-Health channel. Thanks very much for listening, and see you next time.